Tomorrow morning, before you brush your teeth or drink your coffee, stand in front of a mirror and look at your tongue. Is it pink and slightly moist? Or is it covered in white patches, unusually smooth and red, dark and hairy, painfully cracked, or a color you have never noticed before? Your tongue cannot diagnose your liver, kidneys, or heart just by its appearance. But certain changes can provide valuable clues about infections, nutritional problems, medication side effects, dry mouth, low oxygen, or a condition that needs professional attention. And after 60, these changes are particularly easy to miss because many people assume they are simply part of aging. They are not always. I'm Dr. Richard, and today I will show you 7 tongue changes you should never automatically ignore. We'll begin immediately with one of the most common. But stay with me because the final 2 signs may require urgent or even emergency medical attention. Sign number 7, a persistent white coating or white patches. A thin coating when you first wake up can be normal. During the night, saliva production decreases and bacteria, dead cells, and food debris can collect between the tiny bumps on your tongue. This usually improves after drinking water and gently cleaning your mouth, but persistent, thick, or patchy whiteness deserves a closer look. One possible cause is oral thrush, a fungal infection caused by an overgrowth of candida. Thrush may look like creamy white or cottage cheese-like patches on the tongue or inside the cheeks. If the patches are wiped away, the tissue underneath may look red and can sometimes bleed. Older adults who wear dentures may be more vulnerable, particularly when dentures are worn overnight or aren't cleaned properly. Antibiotics, certain inhalers, cancer treatment, diabetes, and dry mouth may also raise the risk. Here is an important distinction. Some white buildup comes off gently, but a white patch that does not scrape or wipe away may have another cause, including leukoplakia or an inflammatory condition such as oral lichen planus. Some persistent white patches require examination because a small percentage may contain abnormal cells. Do not scrape aggressively until your tongue bleeds, and do not treat every white tongue with random antifungal medication. If it remains for more than a couple of weeks, becomes painful, or interferes with eating, speak with your dentist or healthcare provider. Now, sign number 6 may be the complete opposite. Instead of looking white and coated, the tongue may become unusually red and smooth. Sign number 6, a smooth, bright red or sore tongue. A healthy tongue normally has many tiny bumps called papillae. These give the surface its familiar texture. But sometimes the tongue becomes smooth, shiny, bright red, swollen, or sore. This is often described as glossitis, meaning inflammation of the tongue. Glossitis can result from irritation, infection, dry mouth, allergies, poorly fitting dentures, certain medical conditions, or nutritional deficiencies. Deficiencies involving vitamin B12 or folate and some types of anemia can be associated with a red, smooth, tender tongue. You may also notice burning when eating spicy or acidic foods, changes in taste, tenderness around the tip or sides, difficulty chewing or swallowing, cracks at the corners of your mouth. But do not start taking high doses of iron or vitamin B12 just because your tongue looks red. A red tongue has several possible explanations. Supplements can be unnecessary or, in some cases, harmful when taken without confirming the problem. A clinician may need to examine your mouth, review your diet and medications, or order blood tests. There's also a harmless condition called geographic tongue, which creates smooth red areas with pale or white borders. The patches can appear to move from one part of the tongue to another. Geographic tongue is non-cancerous, although acidic or spicy foods may sometimes cause discomfort. So the key question is not simply, is my tongue red? It is this new, painful, persistent, or getting worse? And wait until you see the next sign, because it can look frightening even though it is often less dangerous than people imagine. Sign number 5, a brown or black, hairy tongue. Imagine looking in the mirror and seeing what appears to be dark hair growing on your tongue. It can be alarming, but the tongue is not actually growing hair. A condition called black hairy tongue occurs when the papillae become elongated and trap bacteria, dead cells, tobacco residue, food particles, or other debris. The tongue may look brown, black, yellowish, greenish, fuzzy, or hairy. Possible contributors include poor oral hygiene, smoking, dry mouth, certain medications, antibiotic use, and some medical treatments. Despite its appearance, black hairy tongue is usually harmless and often improves with better oral hygiene and removal of the underlying trigger. Gently brushing the tongue, drinking adequate water, avoiding tobacco, and maintaining regular dental care may help. But do not stop a prescribed medication without speaking with your doctor or pharmacist. And if the discoloration persists, causes pain, produces a strong, unpleasant taste, or doesn't improve despite good oral hygiene, arrange an examination. Now we reach a sign that is especially important for adults over 60, because it is often caused not by age itself, but by medications. Sign number 4. A dry, rough, cracked or burning tongue. Does your tongue regularly feel like sandpaper? Does it stick to the roof of your mouth? Do you constantly need water to swallow dry food? Perhaps the tongue looks cracked or rough, and food no longer tastes the way it once did. This may be connected to dry mouth, also known as xerostomia. Dry mouth is common in older adults, but aging itself is not necessarily the cause. Older adults are more likely to take medications or have medical conditions that reduce saliva. Medicines used for high blood pressure, depression, allergies, pain, and bladder problems are among those that may contribute. Saliva does more than keep your mouth comfortable. It helps you chew and swallow, protects the teeth, controls bacteria, and reduces the risk of infection. When saliva remains low, you may develop a dry or raw tongue, burning or tingling, cracked lips, bad breath, difficulty speaking, trouble swallowing, changes in taste, more cavities or oral infections. Dry mouth can also increase the risk of oral thrush. Drinking water may help temporarily, but persistent dry mouth deserves more than simply keeping a bottle beside the bed. Review your medications with your doctor or pharmacist, but never stop them yourself. Your dentist may also recommend products designed to keep the mouth moist, fluoride protection, sugar-free gum, or artificial saliva. Limit tobacco and alcohol, and be careful with alcohol-containing mouthwashes because they may worsen dryness. If dry mouth is accompanied by severe thirst, frequent urination, unexplained weight loss, or dry eyes, mention those symptoms to your healthcare provider because an underlying condition may need investigation. The next sign is one that many people postpone checking because it may not hurt. That is precisely why it can be dangerous. Sign number 3, a sore, lump, or red or white patch that doesn't heal. Most people have bitten their tongue, burned it on hot food, or developed a small canker sore. These usually improve. But a sore, lump, thickened area, or red or white patch that remains in the same place should not be ignored. Warning features may include a sore that repeatedly bleeds, a firm lump or thickened area, a red or white patch that doesn't disappear, numbness in part of the tongue, difficulty moving the tongue, pain when swallowing, persistent ear or throat pain, a lump in the neck, a change in speech or voice. These symptoms do not automatically mean cancer. Dental irritation, infection, poorly fitting dentures, and inflammatory conditions can produce similar changes. But oral cancer can occur on the tongue, and it is more common after age 40. Tobacco and heavy alcohol use increase the risk, although oral cancer can also occur in people without those exposures. This is why dentists look at your tongue during routine examinations, even if you no longer have natural teeth. A painless patch can matter just as much as a painful one. Do not wait for it to become unbearable. If a sore or patch remains for around 2 weeks, keeps returning in exactly the same location, or worries you, schedule a dental or medical evaluation. Early examination is far better than trying to identify it using photographs from the internet. And now we reach two color changes that should create a much faster response. Sign number 2, a blue or deep purple tongue. A healthy tongue ranges from light to darker pink. Lighting, food coloring, candy, medication, and drinks can temporarily change its appearance. But a tongue that suddenly looks blue, especially when the lips or fingertips are also blue, may indicate cyanosis, meaning the blood may not be carrying enough oxygen. Possible causes can involve the lungs, heart, blood, or circulation. This is not a sign to monitor for several days. If a blue tongue occurs with any of the following, seek emergency medical assistance: shortness of breath, chest pain, confusion, severe weakness, dizziness or fainting, rapid or difficult breathing, blue or gray lips. Do not assume the color is caused by cold weather, particularly if the person is having difficulty breathing or behaving unusually. Food coloring may explain a temporary blue tongue in someone who otherwise feels completely well. But breathing problems plus a blue tongue or lips must be treated as an emergency. And sign number 1 can become dangerous even faster. Sign number 1, sudden tongue swelling. A tongue that has gradually appeared large for years is different from a tongue that begins swelling within minutes. Sudden swelling may occur during a serious allergic reaction called anaphylaxis. The swelling can involve the tongue, lips, mouth, face, or throat, and may begin after exposure to a food, medication, insect sting, or another allergen. Other warning signs may include hives or itching, wheezing, a tight throat, difficulty breathing or swallowing, a weak or rapid pulse, dizziness, vomiting, fainting. Anaphylaxis is a medical emergency. Do not wait to see whether the swelling improves on its own. Call emergency services immediately. If the person has been prescribed an epinephrine autoinjector, use it according to their emergency plan and still seek emergency care. A swollen tongue can have other causes, including infection, trauma, inflammation, nutritional problems, and medication reactions. But the crucial distinction is this: sudden swelling plus difficulty breathing or swallowing is an emergency. This is the one sign from today's list where minutes may matter. The 30-second morning tongue check. You do not need to obsess over your tongue every day, but once or twice a week, check it under good lighting before eating strongly colored food. Ask 5 questions. First, is the overall color still within its normal pink range? Second, are there new white, red, dark, blue, or purple areas? Third, is the surface unusually smooth, dry, swollen, or hairy? Fourth, is there a sore, lump, or patch that remains in the same location? Fifth, is the change improving or has it persisted for approximately 2 weeks? Do not compare your tongue with a perfect image online. People naturally vary. The most important comparison is often your tongue today versus your normal appearance. 3 mistakes to avoid. Mistake 1, scraping too hard. Gentle tongue cleaning can remove normal buildup, but aggressive scraping can injure the surface, cause bleeding, and make irritation worse. Use a soft toothbrush or tongue cleaner gently. Mistake 2, diagnosing an organ from tongue color. A white tongue does not automatically mean kidney disease. A red tongue does not prove vitamin deficiency. A cracked tongue does not diagnose diabetes. The tongue provides clues, not final answers. Mistake 3, ignoring your dentures. Dentures should be cleaned daily and generally removed at night unless your dental professional gives different advice. Poorly fitting or unclean dentures can contribute to irritation and oral thrush. Regular dental examinations remain important even when you have no natural teeth. Your tongue is not a crystal ball. It cannot reveal every hidden disease. but it is one of the few areas of your body you can examine clearly every morning without equipment. Most changes are harmless. A temporary coating may come from dry mouth. A small sore may come from accidentally biting your tongue. A dark color may come from something you ate. But persistent white patches, a smooth and painful red tongue, severe dryness, a non-healing sore, a blue color, or sudden swelling deserve the appropriate response. Some require a routine appointment, some need prompt evaluation, and some require emergency help. The goal is not to become frightened every time your tongue looks slightly different. The goal is to notice a meaningful change before it becomes impossible to ignore. If this video helped you, comment, "I checked my tongue." Then tell me which of these 7 signs surprised you the most. Like this video, share it with someone over 60, and subscribe for simple, practical health information that helps you recognize what your body may be trying to tell you. Thank you for watching. Take care of your mouth, because sometimes the smallest visible change can be an important reason to ask a bigger health question. Medical disclaimer. This video is for general educational purposes only and does not provide individual diagnosis or treatment. Tongue changes have many possible causes and cannot reliably diagnose a health condition from appearance alone. Consult a dentist, physician, or other qualified healthcare professional about persistent, painful, or unexplained changes. Seek emergency help for sudden tongue or throat swelling, difficulty breathing or swallowing, or blue discoloration associated with breathing problems.